Hi guys, welcome. My name is Kieran of One Zen Wellness and One Zen Academy. So I'm just going to go through a few return to play exercises for people who have suffered patellofemoral pain syndrome. I know, proper mouthful. But if you're a runner especially, you may know exactly what this is. It's termed as runner's knee. Not to be confused with IT band syndrome, which is something slightly different. So we know that in all of running injuries, knee by far has the most common injuries associated with it. So we know that it has around 44% of all running related injuries, which is massive. So return to play basically means normally at the end of like a 12-week period, and you start really loading through that knee as if you're about to go into like full-scale running. So I'll go through a few of the exercises there. But why does patellofemoral pain syndrome actually occur? And there may be a few different reasons, okay? No one can safely say that this is the reason because we don't have enough information on that. But we do know that your knee itself is at the mercy of what your ankle and foot and what your hip is doing, and in most cases is not doing. So for instance, if my foot hits the ground and I have too much stability, then there's not enough movement, and that energy has to go somewhere, and it is normally the knee. If I have too much mobility, then my foot will collapse in, and you can see straight away what my knee does, and my knee will bend and turn in ways that it doesn't necessarily like to. It can, but it doesn't like to, especially at impact, because we know that with each step of running, it's about 1.5 to 2 times your body weight. So especially if you're a bigger runner, then that's a lot of energy, a lot of mass going through your knee. Ouch. So with the hip as well, it's at the mercy of the hip. So we have our femur, which is this bone here, and as you're running, it goes for an internal rotation, so it rotates inwards, which is great. But too much rotation, and if I can't pull out of that, i.e. glute medius, minimus and maximus, then I'm in for a really rough time. Okay, so my glutes and my adductors, glute medius and minimus, have to do their jobs efficiently. So if they're not, then chances are I'm gonna smash up my knee, so to speak. The best running trainers in the world aren't gonna stop that from happening, so please just stop trying to put a plaster over a knife wound. Okay, your more advanced running trainers are maybe part of the answer for you, but it's not the total answer. Okay, we need some decent rehab strategies, and you need someone to assess the skill of running. Yes, running is a skill. It isn't just a case of putting one leg in front of the other. So if you do notoriously get injured, especially with knee related injuries, have someone have a look at your ankle, have someone look at your hip and how you're actually running in the first place. Don't go straight for a new pair of running trainers. It may not be the answer for you. But on that note, if you are kind of thinking about, you're relatively pain-free, you're thinking about getting back into running, okay, then there's a few exercises where, although the evidence is a bit grey on what exercises, there's a few exercises that tend to pop up with kind of good reliability behind them. So the first one, let me just remove that stick. So the first one is more of a sagittal plane loading. So you're gonna squat partially, and then you're going to leap forward and land on one leg. And what this does, it improves eccentric load. Eccentric is just where you lengthen a soft tissue under a tension, as you would when you're running. So you start introducing that load as you would do. So to perform it, okay, you squat in a semi-squat position and hop forward, step back, semi-squat position, and so on. So the idea is to create minimal sound. So what we don't want is, I hope you can hear that, as opposed to that one. So I'll show you from this angle. So again, we're trying to accept that load going through my knee, make sure that the foot is landing how it's supposed to, and that my hip is doing its job. Okay, so try anywhere between 6 to 10 repetitions initially, okay? 2 sets, and try that 2 or 3 times a week. Once you can do that, you need to start adding load. And there's 2 ways you can do that. You can either leap further forward, which will naturally increase the load, so it's going to bash my head on the twig, or you can hold on to a dumbbell, medicine ball, and start incrementally building that load up, which is going to be crucial. So strength moving forward is going to be your savior. So make sure you do some strengthening work. Okay, otherwise it may come back. So that's the first one. Second one is a single arm, single leg touchdown. And this really starts getting your glute max, glute medius, glute minimus fired up on all cylinders whilst improving hip extension. And I'll show you from a couple of different angles. So this is my right arm, stand on my left leg, keep that knee bent to about 20 degrees, how it would normally land when you're running. And you're just gonna touch the ground and come back up again. So this lever has to go all the way around. It's not enough to do a Saturday Night Fever. Okay, you have to touch the ground and back up. Touch the ground and back up. And the idea is to try and go faster and faster to ignite the muscle spindles. And so these are nerves in the muscle which recognize the change of direction. So it recognizes the stretch and it creates a reflexive contraction which will stimulate those muscles into actually doing their job properly. So if you've ever had a physio or a trainer say you've got sleepy glutes, I don't like that term because it's crap, but if you've ever had sleepy glutes, then this is how you wake them up, not through slow contraction, but through more ballistic type contraction. Okay, so we started putting load through the knee, started waking up the glutes, and we're going to put those two together in terms of a skiing type movement. So it's more of a lateral hop. Okay, so again, it's about accepting load through your leg in the frontal plane. So this is the frontal plane here. So it gets me strong in that position. So as I'm running, as my foot hits the ground, I want to be strong in that position because that's the most likelihood of where I'm going to get injured. So I need to be strong here, sagittal, and I need to be strong here, and rotation will come a part of that. Okay, and this helps with rotation. So we've got a load in, we've got a stimulating move, and then we've got a frontal load move going on, which is great. Okay, so those three exercises combined, you could do a little circuit, 6 to 8 repetitions or 6 to 10 repetitions, whichever floats your boat. Have about 30 seconds, 60 seconds rest in between, and just cycle those three. I would also add more of a lateral based plank or a frontal plank in. And I know it's old school, but it should be progressed on as quickly as possible. So stage one, okay, would be on your knees, lifting your hips. Make sure we've got this nice alignment here, belly button in, squeeze pelvic floor. So that's stage one. And then from there, you can make it more movement based. You can then get more of a clamshell going on. Maybe an arm movement. So you make it more movement based. From there, you can create longer levers. So my top leg is the leg further forward and bottom leg is just behind. So you've got that staggered stance. So I'll go back to stage one and then stage two movement. Stage three could be, and stage four, you can get your arms going as well. Okay. There's many more times that you can progress it on, but I would recommend is not just settling for a static position. It has to be more movement based, and that's really crucial for the progression. Okay, so just a little run through. We have a sagittal load. Make sure you add weight where possible. Single arm touchdown. Try and go as fast as possible, maintaining at least 20 degrees of knee flexion. Then we have a little speed skater. To increase load, you can increase your hop. And then we have our frontal plank, and it's really to create stability and create cohesion through my abductors into my obliques and further afield. On top of that, you can do a lot of other exercises, but that would be enough to get you started as part of your overall program to get you back into action. Progress running nice and slowly, so don't go through from zero to hero. You've had 12 weeks out, and make sure it's more progressive, but integrate this into your main running program. So start slow, build progressively, and you'll be fine. Thanks for listening, guys.